And welcome, ladies and gentlemen, to this very special weekend edition. Today is the 9/11. Yes, it is that anniversary. Whether you like to remember it or not, it is part of history, and it is 9/11. Well, the American way, and of course, it's the 11th of the 9th here on this side of the world, the way we know it. Well, right now, today, we will be talking about the Daily India Report. Ankita will be joining us very soon. In fact, we might get her to join us first up while we get the up-to-date news on what's happening here in Queensland. Cases have been found, new places of traces have been identified as well. So it is very important to get that update, but we will do all of that after we have had a look at the Daily India Report with Ankita. With that, let's welcome Ankita.
Welcome to the Daily India Report that brings you glimpses of the changing India and the growing engagement of the Indian diaspora with India. In our first story, China and Russia back the aspirations of India, Brazil and South Africa for a greater role at the United Nations. China and Russia reiterated the importance they attach to the status and role of Brazil, India and South Africa in international affairs and supported their aspiration to play a greater role in the United Nations. This was part of the New Delhi Declaration adopted by the BRICS countries, Brazil, Russia, India, China and South Africa on 9 September 2021 at the 13th BRICS Summit chaired by India. The summit declaration in the section on strengthening and reforming the multilateral system called for reforms of the principal organs of the United Nations. The five leaders said they will instill new life in the discussions on the reform of the UN Security Council and continue to revitalize the General Assembly and strengthen the Economic and Social Council. The UN, including its Security Council, should be made more representative, effective and efficient, and to increase the representation of developing countries to adequately respond to global challenges. It also reaffirmed support for a transparent, rules-based, open, inclusive and non-discriminatory multilateral trading system in the World Trade Organization that must heed the interest of developing countries that represent a majority. BRICS adopts counter-terrorism action plan under India's chairmanship. Indian Prime Minister Narendra Modi chaired the 13th Leaders Summit of the BRICS countries on 9 September 2021 and announced that BRICS adopted the counter-terrorism action plan and all partners agreed to accelerate its implementation. A significant portion of the discussions was devoted to the Taliban takeover of Afghanistan and its repercussions on the region. The BRICS leaders called for refraining from violence and settling the situation by peaceful means in Afghanistan through an inclusive intra-Afghan dialogue so as to ensure stability, civil peace, law and order in the country. Responding to a question by PIO TV after the summit, Sanjay Bhattacharya, Secretary, Ministry of External Affairs of the Government of India said,
there was a very strong condemnation of terrorism and that Afghan territory should not be used either for terrorism or for drug trafficking, and that it should not cause or become a reason for problems in the neighborhood. That was another sentiment that was there, which I have also mentioned. There was also a reference that the humanitarian aspects need to be looked at. And as I also mentioned, the role of the UN Security Council was also referred to in this context of Afghanistan. But you will find a very concise, but at the same time substantive reflection of the leadership in the New Delhi Declaration.
This is the second time Prime Minister Modi has chaired the summit. He highlighted that the past year saw several firsts, including a collective position on strengthening and reforming of the multilateral systems and the first ever BRICS Digital Summit on health, despite the challenges posed by COVID-19. He also mentioned the agreement on remote sensing satellite constellation between the space agencies of the five countries, a new chapter of cooperation has begun. India reviews security and terrorism threat in Jammu and Kashmir in the wake of the Taliban takeover of Afghanistan. A deeply concerned India continues to monitor the Taliban takeover of Afghanistan. On 9 September, Union Home Minister Amit Shah chaired a high-level meeting to review security threats, especially in the state of Jammu and Kashmir. Jammu and Kashmir Lieutenant Governor Manoj Sinha, National Security Advisor Ajit Doval, and Army Chief M.M. Naravne were also present at the meeting along with State DGP Dilbag Singh, RAW Chief Samant Goyal, IB Director Amit Kumar, and DG CRPF Kuldeep Singh. The meeting assumes significance in the backdrop of the Taliban takeover of Afghanistan. Sources said that India has been concerned over rising terror activities in Jammu and Kashmir in the wake of the situation in Afghanistan. There have been multiple reports that Pakistan-based terror groups Jaish-e-Mohammed and Lashkar-e-Taiba, both active in Jammu and Kashmir and involved in a large number of terror attacks in the past, have shifted their bases to Afghanistan with a friendly Taliban regime in place. Reportedly, figures from the Home Ministry indicate that so far, 82 people have gone missing from their homes in Jammu and Kashmir and have most likely joined terror groups. UNICEF says 80% of children in India reported learning loss after schools closed due to the COVID-19 pandemic. A study by UNICEF has stated that about 80% of children in India aged between 14 and 18 years have reported lower levels of learning since the physical closure of schools for children amid the COVID-19 pandemic. The study that assessed the impact of learning in children during the closure of schools amid the pandemic found that a substantial proportion of students and their parents reported that students learned significantly less compared to pre-pandemic levels. According to the UN body, school closures in South Asia due to the COVID-19 pandemic has interrupted the learning of 434 million children. The schooling went online with the onset of the COVID-19 pandemic. While the learning was not affected much among those children whose families arranged smartphones, it came to halt for less resourceful children. The UNICEF said that despite significant efforts from governments, low connectivity and access to digital devices have severely hampered efforts to roll out remote learning. COVAX delivery target is cut by 25% as India is unlikely to supply vaccines due to internal requirements. COVAX, a multilateral initiative aimed at fostering global access to COVID-19 vaccines, cut the forecast for the availability of doses for 2021 by 25%, citing export restrictions on the Serum Institute of India. Reports said that India has decided not to share COVID vaccines with the rest of the world till all adults in India are immunized. However, the Indian government has clarified time and again that it has not banned the export of COVID-19 vaccines, but has calibrated shipments keeping in mind domestic requirements. According to the latest supply forecast issued on 8 September 2021, COVAX expects to have access to 1.425 billion doses of vaccine in 2021 in the most likely scenario and in the absence of urgent action by producers and high coverage countries to prioritize COVAX. Of these doses, approximately 1.2 billion will be available for lower income countries participating in the COVAX Advanced Market Commitment. Post the BRICS summit, responding to a query from PIO TV, Sanjay Bhattacharya, Secretary of the Ministry of External Affairs, said the 5 heads of states discussed COVID-19 cooperation and vaccines.
The first thing that they all talked about was the need for extensive vaccination and for the development of vaccines, and in this context, the vaccine R&D center, which is now being proposed as a virtual network, because in today's world there are so many digital and technological solutions that are far more effective. The distribution of vaccines, and all the BRICS members were very appreciative of our role, not only as a major country producing vaccines, but also distributing in times when we ourselves had large numbers who were affected by it.
Happy Ganesh Chaturthi to all Indians and people of Indian origin worldwide. Millions, including non-Indians, love the god of prosperity. However, this year the festivities are muted in Mumbai. The 10-day Ganesh Chaturthi celebrations began 9th September in India and around the world. The festival celebrates the love and mighty of the god of prosperity, Lord Ganesha, son of Lord Shiva and goddess Parvati. One of the biggest centers of Ganesh Chaturthi celebrations is Mumbai in the Indian state of Maharashtra. But this year, the celebrations are muted in Mumbai after the city police banned a gathering of 5 or more people between 10th and 19th September, citing the COVID-19 pandemic and placed several other curbs. All prominent Ganesh manuals would be offering virtual darshan. Mumbai Police Commissioner Hemant Nagrale also issued a video message urging residents of Mumbai to observe precautions during the Ganesh Chaturthi festival, citing the surge in COVID-19 cases. All prominent Ganesh mandals would be offering virtual darshan. Great news for cricket fans with the forthcoming biopic on cricket legend Sourav Ganguly. Bollywood is gearing up for another major sport biopic. Veteran cricketer Sourav Ganguly announced that his biopic film will be produced by Love Films. Ganguly took to social media to say he's thrilled that Love Films will produce a biopic on his journey and bring it on the big screen. Both the star cast and director have not been announced yet. There is of course intense speculation about who will play Sourav in the film about him. Ganguly was the man behind India's cricket revolution in the 21st century. After taking over the captaincy, Ganguly encouraged a lot of youngsters. In Ganguly's era, Team India registered memorable victories and also reached the 2003 World Cup final. However, Ganguly lost captaincy and place in Team India under dramatic circumstances in 2006. His return to Team India and many more things will be covered in the biopic. That's all for this bulletin of Daily India Report. Thank you for watching.
And thank you very much, Ankita, for that update. And very soon we'll be bringing to you the live update from Queensland Parliament, and our Premier will be joining. She did an announcement at 9 a.m., but as soon as we get that on hand, we will be rebroadcasting that for people who might have missed that segment there. But before that, let's take a look at some of the functions and events that are happening. Before that, we'll get a message from our sponsors for the segment, GlobeNet Realty.
GlobeNet Realty. GlobeNet Realty has been the longest established, trusted and respected agency in its trade area. Washa Chandra, Director of GlobeNet Realty, provides honest and ethical service to her customers. If you are thinking of investing in Brisbane real estate market, or if you are seeking professional property management, then you should contact Usha Chandra today on landline 3865 4466 or mobile 0419 775 416. And for further updates, log on to our website www.globenetralty.com.au. GlobeNet Realty is your own local real estate agency. Situated at Shop 52281 Sandgate Road, Boondall. GlobeNet Realty. Real estate is our world.
And GlobeNet Realty, real estate is the world. Don't forget that every Wednesday we have the real estate update with Usha Chandra right here on this channel, covering all the things that happen in real estate, looking at these graphs and the charts and everything. Well, right now, as I said before, that we will also look in this segment at all the functions and events taking place in and around Brisbane. Let's take a look at that now.
the voluntary assisted dying bill. Correct. I think what we don't want to see at the moment we've got a lot of people that have gone into like home quarantine, which is great. So we've identified those close contacts, and can I thank our staff, our contact tracing staff, who've been working through the night to keep Queenslanders safe. So great job there. So we'll be looking to see if there's any seeding that's happening outside of those people that are in home quarantine. Yeah. So next 24, 48 hours, Queensland is critical, especially in the southeast. So please mask up going indoors, register, and anyone who has any symptoms whatsoever, please go and get tested. Okay? Thanks everyone, have a lovely day. Thank you. And thanks Mikey. Thank you.
Mikey does a wonderful job there as well. Well, right now what we'll do is we might go back to that in a minute and see the beginning of that. So that's more so the tail end of the press conference. Right now, let's take a look at all the functions and events taking place.
How's everyone today? Beautiful Saturday in Brisbane. Okay, good morning Queensland, and good morning to all of our Facebook Live followers. So I'm joined today by Dr. Young and our Health Minister, and we want to give an update about that case that we spoke about yesterday. So I can report that we have 5 local cases and 3 overseas acquired. Now the good news is the 5 local cases are from the same family. So that is absolutely really good news, and Dr. Young will explain to you that we actually think we know the source of the infection. So I know there's a lot of concern out there at the moment amongst the community about is there a lockdown today? There is no lockdown today. But I will say this, over the next 24, 48 hours we'll be closely monitoring the situation, and if we start seeing any seeding, then we may have to take very quick, fast action. But at the moment, it's contained to the family. We also have that young girls' school community. They've gone into home quarantine, about 1,000 people there, so we know that people are doing the right thing. But we absolutely need Queenslanders, if anyone has any symptoms whatsoever, to go and get tested. Now, this young girl had a headache and her mother took her to get tested. We also believe that the source of this cluster could be a visitor who came to the father's home from New South Wales. So we are doing further investigations there. So we believe we know at this stage the source of the virus. Now, we also need people to be very vigilant this weekend, and of course we know that another truck driver visited Mount Gravatt. Remember we talked about that the other day, the Mount Gravatt shopping centre. So Queensland, this is the time we need everyone to step up. If you are going into a shopping centre, you must wear your mask. If you are going into cafes and restaurants, you must check in. And I noticed I went to a cafe the other day, and they checked that I was checking in. So if they're checking me, they're going to be checking you as well. So everyone, please do the right thing. And it's absolutely important we see testing. So if anyone has any symptoms, like this young girl who presented to her mother with a headache, please go and get tested. It is absolutely critical. So the next 24, 48 hours will be a very close monitoring of this situation, and Dr. Young will go through a bit more details about that. So can I say too that in last 24 hours we've had 11,888 tests, and our vaccine rates are consistently very good, with 23,631 vaccines that have also happened in the past 24 hours. And of course we saw that Mount Warren hub that we looked at yesterday, that'll be taking bookings today, and Cairns Convention Centre is also taking people today as well. Now is the time, Queensland, to get vaccinated. We now have 55.4% of eligible Queenslanders who have their first dose, and 37.07% of eligible Queenslanders are now fully vaccinated. And as I said, if we get more supply, we will get more vaccines into people's arms. So there is a sense of urgency here, because we are seeing these clusters that pop up, and we need to make sure that we are protected as much as we possibly can. There are thousands and thousands of cases in New South Wales. It is just across our border, and we've seen how easy it is for it to get across our border, whether it's in a freight driver or a visitor from New South Wales. So that's why we have our tough border measures in place, but we can't stop everything. So we need Queenslanders to play their part, and I know that they absolutely will do that. I also just want to mention to people in the suburbs of around that Garden City area, that Mount Gravatt and Sunnybank and Maruka area, to please very much monitor your symptoms, just see if you've got any issues, and if you do have any symptoms, to go and get tested. And if you have visitors coming to your house this weekend and you live in those areas, and probably need to include the northern parts of Logan as well, because they travel to the Mount Gravatt shopping centre. If you're having extra visitors to your home this weekend, maybe take a list, just keep a list of who's coming in, just in case anything happens. But I know Queenslanders are absolutely doing the right thing, and like I said, the next 24, 48 hours we will be closely monitoring that. Dr. Young will also be announcing some restrictions that are in place for aged care and our hospitals, just whilst we have that cluster that has been identified. But as I said, there is no lockdown at this stage. We are monitoring very closely over the next 24 to 48 hours, and we are very hopeful that we have been able to identify the source and get on top of this very, very quickly. And I really want to thank the parents, the mother who took her child to get tested, because to identify this so early has been a godsend. Okay, I'll hand over to Dr. Young. Thank you.
Thank you, Premier. It has indeed. Can I just commend that mother? So her daughter had a headache, and I'm a mother. I know my kids have, headaches and issues and all the rest of it. So to have immediately gone out and got her daughter tested, and her daughter's tested positive, to get that so quickly means we can respond by just asking people to do what they've been doing so well. So to wear your mask when you can't socially distance, to use those QR check-in codes, and, like this family, the slightest hint of a symptom, a sniffle, a headache, anything at all, to come forward and get tested. That's critical. So we now have all 5 members of that family positive across 2 households. So we know this is the Delta variant. I got that genome sequence back last night. It's not linked to the Indooroopilly outbreak, and it's not linked to our recent Beenleigh outbreak that we're still managing. The best that we can see is it's linked to cases in New South Wales. So then we went looking and talking, of course, and this has been a very, very helpful family. So the father who these children saw on Father's Day actually had a visitor from New South Wales stay with him overnight on Father's Day. So we're urgently working with our New South Wales colleagues, because this gentleman who is visiting has gone back to New South Wales to get him tested. But I think that's the most likely source for this outbreak with this family of 5. So the children and the father were exposed to this visitor from New South Wales, who we haven't tested yet. I just confirmed that. We don't have it, but I think it's the most likely source, so we're urgently testing, getting that gentleman tested. Then those children have gone back to their mother, who lives in a separate household with the children, and the mother's become infected. So that 5 people infected. Now, the school, as you heard yesterday, immediately worked with us, and all those 1,000 families went into quarantine, and thank you to that school. They've been brilliant, and that whole school community. And the mother did go to work at the Nathan campus at Griffith University on Wednesday, but saw very few people. So we're quite comfortable there. Then we're just working through where the father works and exactly who needs to be contacted there. But because we've got this so early, we've got it in the first generation of cases, we've been able to bring all this together and manage it. I just need everyone now, particularly in that Mount Gravatt area, in that northern Logan area, southern Brisbane area, it's really, really important that if you have any symptoms whatsoever, you go and immediately get tested so we can find if we've had any further spread of this particular outbreak. And so we just need you to do that and work with us. And then for everyone else, please go and get vaccinated. We're seeing large numbers of people come through to all our vaccination clinics. It's really important. Check whether your GP's got access to vaccine, because GPs are getting just as much vaccine as the state government is through our clinics. So really look where you can get the vaccine and get vaccinated, because we're going to see more incidents like this where we have the virus coming into our community, and the best way to respond is for people to not get sick because they've been vaccinated. Thank you.
So vigilance is everything. We need Queenslanders, and particularly people who live on the south side of Brisbane, to be doing the right things more than ever before. Make sure social distancing, wearing the masks where required, good hand hygiene. If you're having people at your home, making sure that you are keeping track of who is visiting, and of course getting tested and vaccinated. As Dr. Young, the Premier, has said, this mum took her daughter to get tested simply on a headache. That's what we want to see, no matter how mild your symptoms. If you are unwell in any way whatsoever, don't hesitate. Go out and get tested. That way we know whether we have COVID in our community, and we can act quickly to contain it and protect everybody. And of course we have more clinics opening up on weekends, so please, if you haven't been vaccinated yet, jump online today, register to get vaccinated, have a look at those sites where we do have walk-ins as well this weekend, and also contact your GP or your community pharmacies. And I know many community pharmacies are vaccinating over weekends as well. So take up these opportunities. We've now got 55.4% of our population eligible who have already had 1 dose, which is fantastic, but we want to see those numbers increase every day. So we're staying really high over 2,300 again, or sorry, 23,000 again. That is fantastic. So we're seeing record numbers of vaccinations, but as the Premier said, more vaccines come in, the more we'll be doing each day. And it was wonderful to open the Cairns Convention Mass Vaccination Centre yesterday. So please, everybody, now is the time to do the right thing, making sure that you are keeping yourself safe, your family and loved ones safe, and check in. We saw what happened the other week when people weren't checking in. It meant delays in being able to contact, trace and isolate people. We can't afford these delays. Sadly, New South Wales has over 150 deaths now and over 33,000 cases. We don't want to be in that position. So check in everywhere you go. It is your responsibility to make sure you're checking in, and to venues, to business owners, please ask your staff to just stop for a moment and check people are checking in before they take their seats or wander around your stores. That way we'll keep everyone safe. Thank you.
Forgot to mention aged care.
Oh, yeah,
I
sorry.
just- Thank you, Premier. So one thing I did do last night, just to protect the most vulnerable in our community, is that I asked all of the aged care facilities, hospitals, disability care services and prisons within the Logan and the South Brisbane areas, so the part of Brisbane City Council south of the river, to limit visitors, except for end-of-life reasons, of course. And I also ask that anyone who lives in those areas to not visit vulnerable settings elsewhere in Queensland. We just need to. We don't quite have enough of all of those sectors fully vaccinated yet to be able to protect them. So just for this outbreak, I've asked that those vulnerable settings limit visitors. Hopefully we can remove that restriction as soon as possible. Thank you.
What else do we know about the New South Wales visitor that was at the father's home?
He stayed there for the one night. So we don't have other information at the moment. We know who he is. So I've been speaking with my colleagues interstate to get him tested urgently.
Do we know whether he was permitted to be in Queensland?
I don't have any of those details. I only got that during the night. So you can imagine we've been doing a lot of interviews through the night with these people.
And he since travelled
Back to New South Wales.
And he's still waiting to get his test results.
Well, I don't know if he's been tested yet. So we've just got to work with New South Wales to get him tested. So I'm not certain, of course, that this is the source, but I think it's the most likely.
And what else are you looking for in the next 24 to 48 hours? If we go into a lockdown or not, I guess a lot of people want to know that.
Yeah, so I want lots and lots of testing. I really and truly want people to come out and get tested, because the more testing that's done, the more confident I can be that we don't have virus circulating in our community. So particularly people who live in that part of Brisbane, south of the river, down through to that northern Logan part, I really need you to come forward if you've got any symptoms at all to get tested. Now, we'll organise the testing of close contacts, of course, so that's all of those kids in the school and the people associated with the work areas of the two parents, and the people that we've been able to contact at Garden City through QR codes. So people will be receiving text messages about getting tested because their QR code has come up somewhere. So that's really important. But for other people, any symptoms at all, get tested. That's critical. Then we will, of course, be doing all of that contact tracing and testing people that we think are potentially at risk of having been infected and seeing what happens there. So the risk is, of course, that we have someone out there who's infected who goes and starts a cluster. So that's what I want to pick up as early as I possibly can. So really, testing's most important. Then people need to protect themselves. We know masks work. So when you're indoors, you really and truly should be wearing a mask unless you're seated and eating and drinking. Otherwise, if you're going to the supermarkets, if you're going to the cinema, if you're going out and about, anywhere you're going indoors, wearing a mask is critical. And outdoors, if you can't socially distance. So you're standing at a bus stop. If you're standing in a queue somewhere to go into somewhere, just have your mask with you at all times so you can put it on. That's critical. So people can protect themselves. Then I also need people to use those QR codes, because as we're seeing now, it's made an enormous difference compared to a year ago, because we can quickly get that information and send out text messages to people, please go and get tested. So that's really, really important. So please use your QR code. So they're the things that people can do so that we don't need to go into a lockdown.
Of the 5 cases of mother, father and children, does that include the 13-year-old?
Yes, it does. So you have the 3 children and the mother in one household who are all positive, and the father in a separate household who's positive.
Dr. Youngco, do we know how many close contacts are in quarantine now? Do you have a number on that?
Oh, there's well over 1,000 families from the school, so we'll have well over 1,000 people in quarantine.
And the 2 households, where are they?
One household's in Maruka and the other's in Sunnybank.
Prania, can I just ask, so we have no snap lockdown today, but as you mentioned, the next 48 hours are critical. How will Parliament work if we do go into a lockdown? Will you still debate VAD next week?
Look, the Leader of the House, who's also the Health Minister, she'll have discussions with me about that. Look, I'm not going to preempt what will or won't happen, but next week is scheduled to be the debate in the Queensland Parliament of the Voluntary Assisted Dying Bill.
What will it take to throw us into lockdown? Will there be more cases that are unlinked?
Correct. I think what we don't want to see at the moment we've got a lot of people that have gone into like home quarantine, which is great. So we've identified those close contacts, and can I thank our staff, our contact tracing staff, who've been working through the night to keep Queenslanders safe. So great job there. So we'll be looking to see if there's any seeding that's happening outside of those people that are in home quarantine. Yeah. So next 24-48 hours, Queensland is critical, especially in the southeast. So please mask up going indoors, register, and anyone who has any symptoms whatsoever, please go and get tested. Okay? Thanks everyone, have a lovely day. Thank you.
Ladies and gentlemen, that's the update there. So 5 new cases, but still no lockdown. But you need to take those precautions. I know that there are lots of functions and events that have been organized for the weekend. They're still going ahead, but make sure that all the health advice is adhered to. Make sure you have your mask with you all the time. If you're standing in a public place where you have people you don't know, put it on as soon as you can. We need to maintain it and we need to contain it. I know I've been watching some of the comments coming through. People are saying we're coming to a school holiday, and whenever there's a school holiday, we go into a lockdown. It's unfortunate that with the timings, but what needs to be done, and the health and the well-being of the state on a wider scale, on a bigger scale, is what's more important. Well, ladies and gentlemen, until Monday, it's goodbye from me. I hope you have enjoyed this weekend edition. We had the India report with Ankita. She will be back on Tuesday now. So Monday morning we will have an update, but not the India report. And from Wednesday we have the real estate update with Usha Chandra. Until then, it's goodbye from me. Make sure that you remain safe and enjoy the rest of the weekend.